was only a few years into practice. And at that time, the Cleveland Browns had reached out to me due to the specialty treatments that I do. I was hired on as a consultant with the Browns. So I've done 3 different regimes with them. As with our team, there's been many regime changes. So I've been in and out, but I've had experience there. I've worked with NBA players, Major League Baseball players, pretty much every professional athlete out there I've dealt with. So I've been blessed to be able to enjoy that kind of career. It's been fun.
I'm Dr. Kristosik. We have a very special guest on the program. It's Dr. Zach from the Zach Performance Health Center in Westlake, Ohio, and he is an expert in active release technique. He's a chiropractic physician. Dr. Zach, my condition has been chronic, and it's been, going on now since March. And, I've just recently gotten some really good relief from what you've been doing. So talk about it, please.
Sure. As I got to know Dr. J through some talking to him in session here, I saw that he had a passion for movement, and he was somebody that loved playing basketball and wanted to get out there and gain that back. He had had some tragic accidents that had happened, and I was going to do everything I could to try to help him get back that motion. So we started with his case. There was really a lack of motion big time through his spine, through his lumbar spine, through his thoracic spine. He wasn't moving well, okay? We did, like anybody else, a history. I then put him through a brief movement screen, which is it's the basis of what I talked about earlier, called selective function movement assessment, or SFMA. I put him through a couple of movements where I had him, for instance, bend forward to touch his toes. And I was not just looking for, does it hurt? But I was also looking for, does he have full range of motion, or is it limited? So we put him through a series of motions like that. I put him through just like mimicking things that would mimic how he moves, like swinging his leg like in a running stroke. I then had him stand tall and do a hip extension to look at firing patterns. So I'm looking at functional stuff too when I was evaluating him on day one. Did through all that. And what I saw in Dr. J was, like I said, movement was not good. His firing patterns were not where they should have been functionally. Instead of the glute being the primary hip extender, his lower back, I think it was, right, Dr. J? Your lower back, I think, was dominant. And I think on one side, your hamstring was.
But so also right around T12 was really restricted as well. And that was also a very chronic problem. I was cognizant of that. I was aware of that before, but you addressed it in a whole different fashion than anybody else has ever done, because you work on soft tissue simultaneously.
Yeah. So I kind of like to first, like I said, I get a lot from the history, and then I use the quick movement screen just to get me a good idea of what I think it is. Then I go to the orthopedic testing to make sure stuff's safe. Do we have anything serious going on that we have to send out to somebody else, or is it something that I could deal with? So I checked his orthopedics, checked his neurological screening. And then when I kind of felt that it was something that I could deal with, I talked to him about what I thought I saw. And in my mind, I told him, like I would tell any patient, yes, there's a technical diagnosis that we could tag to this, but a lot of times it's just the academic side of things. It doesn't really help Dr. J get back to moving and playing basketball. What he really cares about, what most patient cares about, is, when can I get back to doing what I want to do? Will this hurt? How long is this going to take, right? That's what the most consumers care about. They don't really care about for me to sit there and get academic and give you a bunch of fancy words that you're never going to remember, right? So as we started care with Dr. J, I started with him doing a couple things. I used the Flexion Distraction technique, which is a table like we talked about, just to I want to do a little bit of work on his discs. Also use that table to get some joint movement. And then I used active release techniques, of course, but based on his limited ranges of motion at that time, I had to use some other techniques as well. So I did some active release techniques to Dr. J's hip flexors, some stuff in his lumbar spine, some hip rotators, some hamstrings, just to try to overall loosen up the area the best I could. Also in his situation, I chose to use a different technique called the ArthroStim, which is a device. And I wanted to specifically put some stimulation into the joints in a specific manner that I thought would be beneficial in the stage that he was in at that point. So I used that. And then we did some motion palpation to figure out where we wanted to adjust. And I also adjusted him. I knew that in his case, it was going to be something that was going to take a little bit of time, because he had been through such trauma with his auto accident that he'd had. And I believe, was it a bike accident too, Dr. J?
Yeah, I had an auto accident. I got to a place where there was a crossing the street, and there was a curb that kind of declined, kind of down, and I didn't see it, and I went flying through the air, and I landed. Thank God I had a helmet on, and
Yeah.
I really had another injury on top of the car accident, which was really crazy.
But due to the traumas that he'd had, I knew that there had been some scarring that had happened. There had been some big time limitation going on. So you're not going to see those cases turn around right overnight. It takes a minute. And so I wanted to tell him that, right? And as we went through, we're slowly but surely each session getting better movement. And the last time I had seen him, which was last week, we started to notice that his mid back, his lower back was starting to move a little bit better. Now, in the big scheme of his case, there's more work to do. And really what's going to happen is then we're going to start transitioning into some strengthening stuff with him and teach him how to kind of stabilize better to get back to doing what he wants to do. But that was just an example of how we tackled that case. But
sure. Well, the thing about it is that you also worked on my psoas muscle,
yeah,
which was really significant, and you've done a part of the active release technique on that muscle, which is a paramount, helping to correct this underlying cause of what's going on. Dr. Zach, this has been really enlightening, and you've really shared a lot. Is there anything you'd like to share in closing?
I think for the consumers out there and anybody that's struggling with pain, I think to do yourself a good service is always exhaust all conservative methods first, whether it be through nutritional, like Dr. J tries to focus into functional medicine, whether it be somebody like myself that specializes in soft tissue injuries or nerve entrapments. Don't give up on it.
How can people get in touch with you?
I'm out in Westlake, Ohio. I'm right by Crocker Park. You can find me on my website, which is zachperformancehealth.com, which is just ZAK, zachperformancehealth.com.